Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio, and I'm real glad that you could come back for another segment. Going to be speaking this morning with returning guest Dr. Gregg Sylvester. He's CMO at Seqirus, and he's joining us to talk about some real-world evidence on their MF59 influenza vaccine. Welcome back to Health Professional Radio, Gregg Sylvester.
Thank you, Neil. It's great to be back.
For those who may not be familiar with you, give us a brief background into your area of expertise, and then let's talk about this flu vaccine.
Certainly. So Neil, I'm a physician by training, and then I went on to train in pediatrics and in preventive medicine. And I would say for the last dozen years or so, I've had the opportunity of working in the pharmaceutical industry. And the last 4 or 5 years, I've been with Seqirus leading the medical affairs department.
Well, you are in the business of developing flu vaccines, and there was a recently published peer-reviewed medical journal publication in vaccine. Let's talk about this MF59 influenza vaccine.
Yeah, so MF59 is actually an adjuvant, and in fact, in this study, it was a TIV, adjuvanted trivalent influenza vaccine. Mm-hmm. I will tell you, Neil, that in the United States today, we don't sell a TIV. Now we sell a QIV. We actually added an additional strain so that, as you know, in influenza vaccines, there's always 2 A strains of influenza and 2 B strains. One is an H1N1 and one is an H3N2, and those are both A strains. And then on the B side, we typically put in a B Victoria and a B Yamagata. So the data that we're looking at here is from 2017 and 18, when in the United States we had the trivalent adjuvanted. Now that's licensed for 65 years and older. And why do we do that? We adjuvant it because, like it or not, as we age, our immune system starts to decline. We call that immunosenescence. And so by putting an adjuvant in the influenza vaccine, the adjuvant actually enhances the immune system to do a better job to make more antibodies and the like. And so, in fact, we have found, or we believe, that having an adjuvant on an influenza vaccine, it actually improves the efficacy. And that's exactly what this study looked at, and that's what this study showed.
Now, particularly during the COVID-19 pandemic, the 65 years of age plus population apparently is more vulnerable to many things. But particularly during this COVID-19 pandemic, how is this particularly notable?
Well, that's a good question. And I would think that when our immune system starts to decline over time, then I think that it affects all viruses, bacteria, and all types of pathogens. And so it's not unusual to see that there is a high rate of morbidity and mortality in that 65 plus when it comes to influenza. And we see the same thing when it comes to coronavirus or COVID-19. And so there's a big difference between the two right now, is that with influenza, we actually have a preventive measure. We actually can we give a vaccine. And we recommend vaccines. The United States has a recommendation for an annual flu vaccine 6 months and older. So every 65-year-old, everybody 6 months and older should be getting vaccinated this year.
Talk about the differences between the standard vaccine and this one.
Well, the standard vaccine's been around for ages. It's a 60-year-old plus vaccine. It works very well. Every year, we look to see how well it worked, and that influenza virus is a very tricky one. It constantly drifts and sometimes shifts over the course of the season, and so it's important that we try to match the circulating strains to the vaccine strains as close as possible. And the difference with ours, this Fluad or MF59, is by having the adjuvant, it just reminds the immune system that we need to gear up and make the appropriate antibodies to prevent people from either the severity of flu or the overall prevention from flu.
Are there any populations in a lower age that could benefit from MF59, or is it specifically exclusively for the 65 plus population?
Well, it is only licensed for 65 plus. So we probably ought to focus on that. Adjuvants have been used in other vaccines, not necessarily MF59, but adjuvants have been used in other vaccines to actually enhance immune systems, whether you're very young or you're very old. Oftentimes that age group that we fall into, that middle age of not being children and not being older adults, our immune systems work quite well. And so oftentimes we don't need to adjuvant in that area, but that's something that our researchers are constantly looking at and our scientists are trying to debate. But for now, this vaccine, Fluad, the quad, the AQIV, is licensed for 65 plus.
What do physicians need to keep in mind as they implement this vaccine?
Well, I think that they need to, just like any vaccine, and certainly any flu vaccine, they want to make sure that their patient population is well covered. They want to give their patients opportunities to either come into the office, and if they're choosing to go virtual right now, to send them to the local pharmacies, whether that's Walgreens or CVS or the other pharmacies that are out there. What we want to do is to get the highest level of flu vaccine rates that we've had in years, so that we reduce the burden on the healthcare system, so that, heaven forbid, if we see another upswing in COVID-19, all the hospital beds won't be taken over with influenza and other diseases.
Where can listeners go and get some more information?
Well, certainly any type of information on influenza. The CDC has a wonderful website, and it goes through quite a bit of detail on influenza. So the cdc.gov, you can certainly get the recommendations and a whole host of other information. If you're interested in hearing more or reading more about our study that we just spoke about, you can go to our Seqirus news page. And probably the easiest way to find that is just to Google Seqirus, SEQIRUS.com, and then look for our news page, and it'll go into more detail from what you and I just discussed.
Gregg, always a pleasure speaking with you here on the program. Thanks for returning, and I'm looking forward to our next conversation.
So am I. Thank you so much for having me back, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Dr. Gregg Sylvester. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.